Did you know that chiropractic care works extremely well for rotator cuff syndrome? That's swimmer's shoulder, jumper's shoulder, or just a strain or even a tear of your rotator cuff as long as it's not complete? Well, how does that work? Well, with any procedure, the first thing you need to do is start with an accurate diagnosis. Even though you might be getting pain in the top of the shoulder or in the front of the shoulder, or sometimes it's just deep in the shoulder, first we need an accurate diagnosis. Starts with a physical exam to confirm the problem's not coming down from the neck or from the upper back, referring pain into the shoulder, or even sometimes the elbow refers pain up into the shoulder. Once we know it's not a neck or back problem or a pinched nerve from the neck, then we have to look at all the tissues around the shoulder. Is it a soft tissue problem involving ligaments, involving tendons, involving the muscle belly itself, maybe involving the ligaments, or what's called the capsule, the surrounding structures of the joint? Well, that's where an accurate physical examination comes in. To see if it's the non-contractile elements of the shoulder, meaning the ligaments or the capsule, we go through a range of motion that's passive and see if it elicits pain. If that doesn't elicit pain and the range of motion is full, it tells us it's probably not the non-contractile elements. If pain occurs with motion or movement, it's probably the ligaments, the tendons or the muscles, the contract element. So how would we check that? Well, we check all the different muscles of the shoulder girdle and rotator cuff against resistance. For example, hold the arm here, I'm going to push down, hold. Is there pain in that position? Checking the supraspinatus. Thumb down, hold from that position. Any pain? Thumb up, also checking the supraspinatus, but different fibers of it. Do you turn up like that? Turn up. Infraspinatus, another rotator cuff muscle. Turn down. Subscapularis, another rotator cuff muscle. Push straight out towards me. All these different movement patterns are checked, pushing forward, pushing back. That tells me what areas are involved with the contractile elements, your muscles, your tendons. If there's pain with those, that tells me it's more of a muscular component. If it's with passive range of motion, it tells me it's a little bit more of the ligament or capsule. Very quick overview of the examination process, but make sure you get a thorough exam to determine where the problem is. So let's say we know it's not a problem with joint motion, that the joint's moving properly, and that it's not a nerve problem, or that it's not a restriction in the ligaments or a torn ligament, something like that. It's just a muscular involvement, a tendinitis. First thing we like to start with some deep soft tissue work. It can be done two ways: by hand, manually with active release, or with instruments, Graston. I'm going to demonstrate Graston right now over the supraspinatus and trapezius muscle because Graston's a little bit different. Active release, getting in there with my thumbs and my hands, works very, very well. I've been doing active release since '91. A lot of people know about it. Graston uses a stainless steel tool to help break down the scar tissue and the tightness in the muscles. It also drives blood to the area. Research has shown that an area that has been injured, they've even cut ligaments and done mechanical stimulus over them. They found they healed up quicker and with a higher degree of tissue as a result of that. So the Graston works really well. We'll work all over the different muscles in different planes and different ranges of motion. Now this is really good because you notice, turn this way a little bit, Graston will make your skin red. You can see that. That's normal. It doesn't get any more red than that usually. If I was really working over a deep, deep tissue, if I had to get down way underneath his traps, I would have to get with a different tool. I'd work very deeply. It might get a little black and blue. Very transient change in skin color. After the Graston, sometimes it creates some inflammation, so then we'll put ice over the area and we'll stretch it because we want to maintain the flexibility we created, but we like to put a little ice, and sometimes we use a little electrical stimulation to keep the inflammation down. Then we want to support the area passively as well as actively. Passive support, the best way to do this is with kinesio tape. It's a stretchy sports tape. A lot of athletes are wearing it. You may have seen it in the 2008 Olympics, in women's volleyball. Kerry Walsh wore it all the time. So let's say we're going to tape his infraspinatus muscle. It's a functional tape. It enables good support of the area without restricting motion, helps keep inflammation down. So that'll support the infraspinatus muscle. And then a lot of times we just did the kinesiotape over the trap and supraspinatus to support that. We'll put the tape coming through this way. When the kinesiotape works, it's a home run. You feel the difference immediately, and it will stay on for several days. You can shower with it and bathe with it. Goes over this way. Good. And come back down. Let the arm hang, please. And now pull the arm across again. So a little bit of Graston, dry blood to the area, loosen up any scar tissue, some therapy to keep the inflammation down, a little bit of kinesiotaping over the area to stabilize it, and then from there we progress to corrective exercise. First is stretching, then from stretching we go to gentle strengthening in a neutral range of motion, and then from there we progress to strengthening with the arm up at 90 degrees, and then finally overhead activities with the strengthening. Begin slow, and then finally add speed. We also have to make sure the neck and back are stable because all of your rotator cuff and shoulder muscles attach to the neck and back. So this also has to be balanced as well. So you treat the whole complex. Now you know that rotator cuff injuries do respond well to chiropractic care.